terms of a medication that's been looked at a lot for how it has an effect on cognition, meaning how you think, one of the medicines that comes to mind is a medicine called ozanimod. Its brand name is Zeposia. It's a once a day oral medication. And besides looking at relapses and besides looking at disability in MRI, they really did a lot of focus in their clinical trials looking at MRI and also looking at brain volume. What we mean by that is, unfortunately, all of us shrink over time. I think we all know that as we age, we get smaller, our brains shrink too. When you have normal aging, it goes down. When you have Alzheimer's, it goes down a lot faster. And MS is somewhere in between. And our goal in MS treatment is, instead of being like this, to get you closer to what happens in somebody who doesn't have multiple sclerosis. And that medication, Zeposia, has very good data in terms of its ability to help with cognition, to help with thinking in multiple sclerosis. The other important part of when Zeposia was approved is that it really encouraged other manufacturers to spend more time not just thinking about walking or moving your hands or other things, but also to think more and to try to catch up and think more about thinking, about how we affect people's cognition. You asked about, you know, how we see other medications, especially things like metformin in multiple sclerosis. When we take an older medicine that's approved for something else and we try to look at it for multiple sclerosis, it's very interesting. It's interesting because those medicines are readily available, they're generic, they're cheap. And so the question becomes, do we start adding these medicines to what we're already doing? And what happens is a study has to be done once, then replicated, repeated in another population, then probably replicated again before doctors really feel comfortable in using it in their patient populations. But eventually, what does happen is other medicines start to creep in. A great example that's been around for longer is the use of the statins. So, the cholesterol lowering medications. Many people may know that they were looked at in multiple sclerosis, and it looks like they have an effect on brain atrophy, on slowing down the brain shrinkage that can happen in multiple sclerosis. And so, for a lot of us MS specialists, it may be something that we add on. We may say, well, how's your cholesterol? Okay, well, it's not bad, but let's add this medicine that may also help with your thinking. And when we do that, we have to also weigh the benefits versus the risks. Statins, like everything, have potential for side effects. And one of those can actually be muscle pain that people can have. And obviously, with multiple sclerosis, the last thing we want to do is give you muscle pain or give you a medicine that affects your liver. But sometimes we'll think about doing that. And so I think whenever you find something new where it's an older medicine that's being tested for multiple sclerosis, and you find something exciting and it shows it in a small number of people, important to bring that information to your doctor, because your doctor may not have read that latest study. Your doctor may not be on groups where they have these discussions. Two of the biggest things that I think I did in my career were actually in 2009. One of them was this idea of reporting back in real time to people back home what's going on in scientific conferences. And many of you saw me with years going around like this and saying around the world with MS World. For a decade, I served as the chief medical correspondent for MS World. And before that, I was doing it. And after that, I've continued to do it. But the idea was to take scientific information and to not leave it there in the dusty textbooks, but to bring it to people back home. I'm actually right now working on a manuscript to talk about what happens in social media throughout the years. When we really looked back in 2006, Twitter came out. 2009, I started my Twitter account in April. In June of that year, Professor Giovannoni started his Twitter account. We did a lot more at that time of blogging, writing longer pieces. He continues to do that. I've noticed that unfortunately, especially Americans, read less and less. I like to put things into that 140 characters or 280 characters, or to do them on video like we're doing here today. But the other thing that happened in 2009 was I was frustrated when doctors would wait for months for an MS specialist to come to town, and they would say, oh, I have a CD of an MRI, can you help me with it? And I said, well, it's 2009. We have the internet. We didn't have the cloud yet, but we had this idea of uploading. I said, why don't we get rid of the private information, upload it, and then we can have discussions. Out of that was born the Southeastern MS Consortium, which ballooned now to over 1,300 neurologists. It's all 50 states, many other countries. We make up a third of all prescribers of MS medications in this country, almost 10% of neurologists. And you don't know it, but when you're being seen, afterwards, your doctor may be asking for a second opinion from their colleagues. They're not sharing your personal information, but this is good. This means doctors are freely talking with each other, no pharmaceutical involvement, and we're having honest discussions. And some of the actual discoveries about how to treat some of the side effects of the newer medicines, actually, that first discussion was on our private group where we were having that conversation. We've been able to change policy in terms of insurance companies nationally. We've been able to have effect in state capitals as well as in the federal government. And part of that reason is because we treat people like equals. We realize it's not a this side or that side of medicine. We're all in this together. People often get frustrated when they think about how their insurance companies are involved in their care. The truth is, there's more than two people in an office visit. When you go to your office visit, it's not just you as the person with MS. It's not just your care partner there. It's not just the neurologist and all the allied health professionals. It's the person paying. And even though you may be paying a copay, generally, for most people, there's somebody else who's paying the bulk of their care. And that person oftentimes is the federal government with Medicare and other programs, but I know other times are commercial insurance companies. And so they feel like they have a right to have an opinion about what happens in your care. And so one of the things we've tried to do is to really work with those insurance companies to make sure that decisions they're making aren't just out of left field, aren't just about the price right now, but how can they have savings further on? If we can make you better for the long term, we can bring savings to everyone.